Hello, my name is Kateryna Louchnikov and I am PhD candidate at UC Berkeley. And today I wanted to present you the project where we will investigate how Ukrainian war context influence on engagement in hope groups. Just a little bit of the background. Since February 2022, when Russia's full-scale invasion in Ukraine forced to flee around 13 million of people, most of them who are women and children. And as for now, we have around 7 million people staying abroad and 4 million staying in Ukraine. At some point, Poland became like a hub where all Ukrainian refugees were staying, and it started as a community-based participatory research where Ukrainians showed interest to find the resources, specifically psychosocial, any type of help which can help them during the crises and the war. And this project started as a collaboration between World Without Orphans, Parenting the Lifelong Health, Oxford University, Children's Mission, Ukraine Without Orphans, and Viva, who partnered to design the Hope Groups. Hope Groups are a part of the free phase model designed to be crisis ready and consists of 12 sessions, psychosocial interventions, which aiming to help parents and caregivers to help with the children to adapt in a new in a new environment and just provide the psychosocial support. The method is a cluster randomized controlled trial, facilitator match, where facilitators were recruited from the different standpoints at churches, refugee shelters, NGOs, and faith-based organizations. And further, they were trained to perform these hope groups. Participants, on the other hand, were recruited from their network because Ukrainian mentality usually refers to the more conservative and not having a good faith, or believing from the outsider. So specifically, this type of the intervention was incorporated. Since this is an ongoing research, which started from the December 2023, for this project, I used only information from the baseline surveys, but overall we have 4 time points: baseline, end line, 1 week post-intervention, and we're still working on a 6-week post-intervention and 6-month post-intervention as well. As for the results, you can see from the figure 1, which is presented the choropleth map, showing the proximity to active war zones and participants number from each oblast. From the 510 participants from both arms, 255 in each arm, we can see that 8 out of 24 oblasts, which is another name for the regions in Ukraine, are in close proximity to active war zones between February 2022 and December 2024, and around 44% of participants coming from the intervention and control arm from the oblast near to the active war zone since the full-scale invasion. On the bottom, you can see the bar chart representing the percentage of participants and displacement status by the treatment status. And what we find out that around 70% of participants either live in Ukraine or internally displaced. And relocation within or outside Ukraine may result in varying level of stress, ultimately influencing mental health outcomes. What we conclude is that people are enrolling in the program from a variety of regions and across war intensities. But for the further analysis, we recommend to collect more data for the informations like air drone attacks, sirens, shelling events, and experience of occupation, because we believe this might be tightly correlated to the oblast where participants are coming from, and it will help to understand the broader impact of the intervention. We believe that this type of intervention might be scalable and implemented in a different zones where the crisis and war is happening. As far as I know, at this moment, hope groups already implemented in Colombia, and looking forward to work on Asia, specifically to the Palestine or Lebanon, to implement this type of the implementation, because pre and post surveys shows that there is a high results. And since a lot of people right now, like around 2 billion people, reside in war-affected regions, it might be applicable to show and implement in another context. But it's important to adapt to the context of the country, and specifically to the mental health. Sessions might be adapted to the context of the country where it's implemented, as well as the collecting the variables sufficient to the situation. In the end, I would like to present my sincere appreciation to my preceptor, Sydney Tucker, at the University of Oxford, UC Berkeley Public Health Department, especially Sandy McCoy, as well as the World Without Orphans and West Region Public Health Training for the support, resources, and these opportunities. If you would like to contact me to discuss more, I would be more than happy to elaborate on this topic. Thank you for your attention.